What lessons can medicine learn by listening to those who live it every day? What happens when patients advocate not just for themselves, but for others like them? The stories that shape the future of healthcare are the stories we tell today. This is the Patient Perspectives Podcast. Hello and welcome back to the Patient Perspectives Podcast. If you're listening to this on its release date, Friday, February 28th, happy Rare Disease Day. This is a special feature, special edition of the podcast highlighting members of the rare disease community. I can't wait to share more of those stories later on in the episode. Some of them are from people that you may be familiar with, prior guests on the podcast, Kait Williams, Abbey Hauser, Jonathan Cappiello, Dan Shockley, and some new voices that you haven't heard yet, but you will hear more from soon, Camryn and Jesse Mercury. But first, I wanted to share about Rare Disease Week on Capitol Hill. I just got back from Washington, D.C. last night. I went with the Young Adult Rare Representatives, part of the Every Life Foundation for Rare Diseases, and I just have to say, what a transformative experience this was. This was my first time advocating to legislators. I've advocated in other ways, but this was the first time I really went to advocate on policy and bills and legislation that is directly impacting the rare disease community. So I was there Tuesday and Wednesday. Tuesday was legislative conference where we learned more about the bills so that we felt confident going into our meetings on Wednesday with the senators and representatives. And so Tuesday was a great learning day. I learned a lot more about these policies and the ways that they are impacting families and patients affected by rare disease, including myself. And so that it was really eye-opening. It was also an emotionally draining day just because these are heavy topics. There's a lot of uncertainty in this area, and getting to connect with and hear stories from other patients and families and caregivers, the connections that I made were so meaningful. One thing that really resonated with me throughout Tuesday's meetings were that we are all in this together and rare voices are powerful. And I just really felt like we are a group of people who are capable of making change, and we will make change because we have to. So, after learning about the bills and the policies on Wednesday, we took our messages to Capitol Hill and we met with our senators and representatives. I met with the Massachusetts legislators, and I feel very grateful to be in Massachusetts and for our state legislators because from the start they were fully supportive of every ask that we went in with. Most of the Massachusetts legislators are already part of the Rare Disease Congressional Caucus, which was something that a lot of people went there advocating for their legislators to join. But Massachusetts has significant support in that area. Some of my top priorities going into Rare Disease Week and these meetings with the legislators were related to NIH funding and cuts to Medicaid and the Pediatric Rare Disease Priority Review voucher. And all of these directly impact research, innovation, treatment, access to care for individuals with rare diseases. And rare diseases, first of all, they're not so rare. There are 30 million Americans living with rare disease. 70% of rare diseases are pediatric onset, so they begin in childhood, including mine. And with the pediatric onset, if there's not a treatment, if there's not a cure, that often means these are lifelong conditions. Rare diseases are chronic diseases. In Healthcare, you see a lot of focus on chronic conditions, diabetes, heart conditions, kidney disease. And in those discussions of chronic diseases, rare diseases are left out, which is unfortunate because they are very much chronic diseases. So, in addition to going to Capitol Hill to advocate on these policies, we also went to generate awareness on the real impact of rare diseases. Rare diseases impact real people, real humans. And a message that was so clear throughout the week is that rare diseases are not so rare when they impact you. It's a very real impact. My rare disease, Camryn syndrome, is a skeletal dysplasia. There are no clinical trials related to it. There's no approved treatment. There's no cure. Symptom management through highly invasive and extensive surgeries is the only available treatment. And this condition presents on a spectrum, so people can be born with a rather mild presentation of it up to very severe. And it most commonly affects females because it is highly fatal in males. And that is always a very heavy thing to think about. So I'm passionate about bringing awareness to not only this condition, but other rare diseases because everyone deserves to have a voice and deserves to be seen. With my rare disease, it is so rare that it may never receive the funding for a chance at better treatment, but there are many diseases out there that are so close to a treatment. Policies that I went to Capitol Hill to advocate for, such as reauthorizing the Pediatric Rare Disease Priority Review voucher, discussions of funding for the NIH, FDA, those directly impact the ability for new treatments, cures, better treatments to become available and to not only improve the quality of life of individuals with rare diseases, but also save lives of individuals with rare diseases. So the last few days have been amazing, and I didn't really know what to expect, but I met I met some incredible rare disease advocates. I met Abbey Hauser in person for the first time, which was wonderful. I met so many strong, fierce, determined advocates affected by rare disease, and that was so meaningful to be able to be with a group of people who understand, who get what it's like to live with the uncertainty of rare disease, to get what it's like to not always be seen, but to have a strong voice and say, here we are. We are not going to settle for any less than we deserve, and just showing how beautiful the rare disease community is. If anyone has questions about Rare Disease Week or how to get involved in advocacy in that space, please feel free to reach out to me. I would be happy to share more about my experience and how I got connected with it. But now for the remainder of the episode, I hope you enjoy these segments from others in the rare disease community. Like I said earlier, some you have not heard from yet. And the first person you'll hear from, Camryn, you will hear her full episode this Sunday, March 2nd. She has fibrous dysplasia and has an incredible story. She's another person who I met on Capitol Hill for Rare Disease Week, and I was so impressed by her after our podcast recording. We did the recording before I met her in person. So I was so impressed with her and her story and her journey and how she has taken her diagnosis and now is a PhD candidate researching her diagnosis. Absolutely incredible. She's one of the coolest people. So here's a segment from her, and I hope that you will also look forward to her full episode coming out this Sunday to learn so much more about her. So here are more voices from the rare disease community.
So I was diagnosed with fibrous dysplasia 20 years ago. The 20th year anniversary for fibrous dysplasia is kind of a big deal because the genetic mutation that causes FD is on chromosome 20. So it's like a big exciting one. I'm also on the patient advisory council for the FDMAS Alliance, and it's also their 20th year anniversary. So I kind of like that we were born together, I guess. But yeah, so I was diagnosed 20 years ago. But kind of the experiences that led up to that start when I was 3. I had a tooth that erupted as normal, like a baby tooth, that came down, and it went back up again. I have like a very type A mom who kept record of all of our development, me and my brother. And so she had like a detailed baby book about when each tooth came through. And so she was like, I could have sworn that that tooth came in. So she went back and checked the baby book, and sure enough, that tooth had, she had written down that it had come in, but it had disappeared. And so I was taken to the dentist and they did a Panorex, and the Panorex was actually overexposed. So they, because I was so little, I was 3, they didn't want to give me more radiation. So they didn't repeat the Panorex. So we would have known then, based off of that, if it had been like correctly exposed, that I had fibrous dysplasia in my cheek. But we couldn't see it, but he was like, I'll remove the tooth. It seems to be problematic. So that tooth was removed. And then because of that, my mom kept regularly checking my mouth, of course, to make sure none of my other teeth were just up and disappearing. And so it was right around my 6th birthday when she kind of looked in my mouth to do sort of the regular check of that all my teeth were there. And my whole palate, the whole roof of my mouth, instead of being concave, was convex. Like it was just this huge bump on the roof of my mouth. And my pediatrician looked in my mouth and he was like, I don't know what this is, but I'm going to find people who do for you. And so in those early stages, the pediatrician really was sort of bringing people on. We were sent to a doctor in Portland, Maine, and he was like, I know exactly what this is. This is a simple dental tumor. I'll remove it and she'll be perfectly fine. And as my parents were leaving his office with me, they were like, this just doesn't feel right. And so they called the pediatrician and asked for a second opinion with someone else. And I was set up with an oral and maxillofacial surgeon at Massachusetts General Hospital. And he was fantastic. My surgeon was fantastic. But I had a biopsy a week later. This kind of all moved really fast. I know that so many people with rare diseases have this kind of long diagnostic odyssey, but it moved really quickly for me. I think just because the nature of FD, you can biopsy it. And so I had that first biopsy. The surgeon had made the decision that if it came back, the quick preliminary biopsy, like the frozen section, if it came back as cancerous, they would close me up, and send me home so as not to like distribute the cancer cells. And it did come back as cancer from that initial biopsy. So I was closed up and recovered, and they started kind of prepping me for chemo. And then the final biopsy results came back, and it was fibrous dysplasia. And he called my parents, and he said, "The good news is it's fibrous dysplasia, but the bad news is it's fibrous dysplasia," which is basically like, the good news is she doesn't have cancer, but the bad news is that there's not a cure. And so I really continued to have lots and lots of surgeries. That was my course of care for a long time. I had 21 surgical procedures from the time I was 6 until the time I was 13. So it was pretty much every like school vacation I was having surgery, but there really, really was not options for like pharmaceutical treatment at that time. I tried a couple of different bisphosphonates, and they both didn't stop the lesion from expanding. FD causes these lesions of like weak, fragile, scar-like tissue. And so mine happens to be in my maxilla, zygoma, and orbit, so kind of my whole left side, my left cheek. And yeah, that was my course of care really until I turned 13, and we decided that what we were doing wasn't really sustainable long term with all of the surgeries, and so we decided to try denosumab experimentally. So as far as general consensus is basically that I was the like first female child put on denosumab. It's a medication that was intended for osteoporosis. And so I went on that, and I have had great success with denosumab. It's not as effective in every patient. Every patient with FD is so incredibly different. And but I just happen to be one of the lucky ones who's had such a great response to denosumab. So it really gave me that time to not have surgery and to like get involved in advocacy and pursue those avenues.
I'm joined by Jesse Mercury, who has a long history with a mysterious illness that went undiagnosed most of his life, eventually revealed to be mast cell activation syndrome, or MCAS. Living through medical uncertainty developed his passion to share the stories of people living with chronic illness and disability.
My illness has come and gone throughout my life. I had issues going all the way back to second grade. I was in a moldy classroom and got really sick, and we didn't know why. Brain fog and headaches and, just sort of mystery, general mystery malaise. And then again in high school, it happened in a moldy classroom, and this time it was way worse. Then again in my 20s, significantly worse. I was off work for a year. I started having mobility challenges. Then again in my 30s, when I was 32, I had to leave work, and everything just went completely downhill. And I spent about 6 years disabled. Ended up getting on disability, was using a wheelchair, went from a cane to a wheelchair. Just my body just completely stopped working, and we had no idea why. And it really changed my entire perspective about life, the universe, and everything. Eventually got a diagnosis just a couple years ago when I was 38, and I'm now 40. And having a diagnosis completely changed my life. I'm back up on my feet. Back to work full time, getting off of disability, just got married, doing jobs that I'm very passionate about and love so much, and am incredibly grateful to have regained most of my health. I live with a chronic illness, and that is a constant everyday struggle. And I had a, unusual presentation of mast cell activation syndrome. It's not usual for someone's legs to turn off, but I also have something called small fiber neuropathy, which can make your legs malfunction. And it's a form of dysautonomia. And we believe it was caused by mast cell activation syndrome from this release of chemicals in my white blood cells. We think that's why I have small fiber neuropathy. There's research happening around that. But this is all on the cutting edge of research where there really isn't a firm scientific understanding yet of me, of my body. But I just got so lucky that I found doctors who were willing to try things and willing to research and learn about the cutting edge of research. I think the first official widespread diagnosis of mast cell activation happened in 2008. So when I started looking, there was no answer, and that's another piece of my story is like, there was no answer. It's deeply frustrating when your life is on the line and all you want is help. And where do you go when you need help? You go to the doctor, and then to not get help at the doctor, it sort of shook up the foundation of my personhood, my sense of self and who I believed myself to be. And it wasn't until 2 years in that I started to feel comfortable with the idea that I have a diagnosis. So I've been trying to learn to keep my perspective open, keep my mind open, and I think that's served me well. Because thinking you have the answer and then finding out you don't, which I've been down that road a couple times, it's hard. It's really, really, really hard. Not just on you, but to your loved ones, to your family, on your job. These things are like spider webs that like reach out into every aspect of your life, and it affects you on so many different levels that you can't even calculate until it's happening to you. If there is a potential with a disease, but it is rare, explore it with your patient. Patients come to people because they have rare diseases. And this whole idea that if it's rare, it doesn't happen is wrong. It's in the textbook, 1% chance. You got to be willing to explore the 1%. If you have a patient that has seen 100 doctors and your first reaction is, oh, I can't help you because you've seen all these doctors, that's wrong. Your first reaction should be, maybe this person is that 1% and no one else has looked there. So try. It's okay to be wrong, but this person is trying to look under any rock that they can to improve their quality of life. And all we're asking is for you to lift up one rock and look underneath. And there might be nothing there, but that is a huge service to that patient, because finding out what you don't have is a step on finding out what you do have. My full genome sequencing yielded nothing, but it told me I didn't have 8,000 diseases in one test. It was so valuable. That's life-changing information to have. And that, again, helped us to look when MCAS came up. It's like, well, that can happen. That can be acquired. You're not necessarily born with it. So that's a good avenue for us to look down.
I am joined by Jonathan Cappiello, who I know through the Young Adult Rare Representatives of the Every Life Foundation for Rare Diseases. He is a young adult living with an ultra rare disease that affects only 20 people worldwide, called 3-hydroxy 3-methylglutarol CoA synthase deficiency, or HMG CoA synthase deficiency.
My rare disease kind of has two different acts. So there's Act One and Act Two, as I would describe it. Act One is from when I was basically an infant. I was 20 months old. In December of 2000, I went into a coma 5 days before Christmas. And with that, basically what had happened, I was an infant, a toddler, as I mentioned. So I'm only going on the recollection that my mother has given me, as opposed to me actually like remembering it vividly. So basically, I went into a coma. They did life-saving measures, and by beyond some miracle, I survived. Fast forward through that horrible, fateful day. I was released a few days before Christmas, and then fast forward through the holidays. January 2001, from my understanding, my mom brought me to a geneticist. I live 45 minutes outside of New York City, so I'm very privileged to have access to some of the best healthcare in the world. I am fully understanding that others do not have that, so I like to take that moment of gratitude. Through some tests and various measures, I was diagnosed with a long chain fatty acid oxidation disorder. And basically, kind of like my current diagnosis, they're very similar. So with an FOD, my body is not designed to, I'm missing an enzyme that produces fat. And that was my diagnosis. It was a rare disease, but it's not as rare as what I'm currently diagnosed with. So I had, through my first act, I grew up in a relatively typical childhood. I just had to focus on making sure that I had low fat, things of that nature, made sure that I was giving my body enough electrolytes through Gatorade, things like that, through those preventative measures. I was hospitalized a lot just because if I got sick and couldn't eat, I went all the way until I was 20 years old with this diagnosis. Genetic testing was out of the picture. It was maybe $100,000. Then something changed. It became more affordable. My mother, my father, myself, and my siblings all took a test. And it came back that I have 3-hydroxy 3-methylbutyryl CoA synthase deficiency. And basically, that is a more rare version of my FOD diagnosis, where my body is not producing the ketones needed, and I'm missing that 3-HOMG enzyme. So, in short, nothing has really changed between Act 1 and Act 2. I just have a more definite diagnosis. What I would say is explaining my diagnosis and getting medical professionals to actually understand and like be like, okay, I need to learn about this because I believe that learning is a lifelong it's a lifelong treasure that we are able to learn. We can learn in our 20s, our 30s, and I'm sure when we're in our older years, we can learn as well because learning never stops. But my mom had a very good relationship with my medical team at the local hospital. And basically, instead of going through the emergency room to get admitted every time, my condition was so crucial at the time that she was able to call the pediatrics floor and say, hey, Jonathan's not well. Can I speak to Dr. So and so? And we can get him admitted because going to the ER proved time and time again to be quite dangerous for me. I'll never forget there were 2 different times that they tried to take the easy way out and just put a band-aid on a bullet hole, essentially. And that is why I was able to go to admitting because they tried to give me unpractical treatment that may have worked for another patient, but did not work for me and how my body is designed. Uh, I was so rare at the time that extra care needed to be placed on me because when you are that rare, only certain professionals know how to treat you because they've been working with you, and then everybody else kind of has to learn as they go along. Some medical professionals needed to have continuing education on my diagnosis. This brings up a great story, actually. So, with my main diagnosis, I also have ulcerative colitis. And something about my colitis is that oftentimes I have to get procedures done like colonoscopies, and I aged out of my pediatric gastroenterologist, who I absolutely adored. So wonderful, so patient forward. I was recommended to someone who was local to my community. So I went. The appointment was fine. He was very nice, but he was not the doctor for me. And I knew he was not the doctor for me because this was my first appointment. I think I was freshly 21. I'd gone there. I explained to the nurse, like, hey, listen, like I have this rare disease that only 20 people in the world have. So I explained it. She understood. And I said, can you pass this along to the doctor? Thought maybe the doctor would read it, even like skim it. This is like what needs to happen. And a big pillar of my condition is I cannot fast. No ifs, ands, or buts. I can fast for blood work, but I can't fast for like 24 hours. So he was like, you need to have a colonoscopy. So I was like, okay, great. I need to be hospitalized the night before. I need to be on D10 to give me the nutrients I need since I'm missing the enzyme that provides those nutrients for fasting. And I need, yeah, that is what I need. Did not listen. Said, okay, like we scheduled you for March 2nd. I don't know why I remember the date, but we scheduled you for March 2nd at 8 a.m. You can fast at home, blah, blah, blah. And I said, this is what I need. Did not listen. I went to the front desk. I canceled the appointment. I said, I'll let you know when I'm able to come back. This was not a match. You were all lovely, but you're not listening to me. So I ended up going back to my pediatric office to the adult wing. And he understood. He was okay, we'll admit you. And then it ended up working out. So I will never forget that because the doctor was really nice. And I'm sure for like a functioning patient, he would have been like, okay, like this is great. Like I think we would have had a great relationship. But for me, a lot of people don't understand rare diseases and but on the other hand, on a really quick sidebar, is that I got a new PCP this year. And I got the opposite where she was like, give me all the paperwork. Tell me everything. What meds are you on? How can I help? Let's get you this, this, and this. So I definitely think that providers can make or break the experience. And sometimes you have to get a second opinion because it can be crucial for your health and you may land on someone who will listen.
This next rare disease highlight comes from Abbey Hauser, who you may remember from a prior episode on advocacy and owning your story throughout your diagnosis. Here's more from Abbey Hauser on their journey with classical Ehlers-Danlos syndrome.
Especially for me, my story with classical Ehlers-Danlos syndrome is different than a lot of people that I meet with EDS of any type because I was diagnosed really young. So I was diagnosed when I was like 6 or 7. I think we started the process at 6, like got the diagnosis at 7. Solely because my symptoms were fairly severe at a young age. I was dislocating my knee, like rolling over in bed, and all these things that were like major red flags as opposed to what most people experience at a young age with any form of EDS, which is just joint pain or things that can easily get kind of dismissed, or a lot of kids are hypermobile, so it's really hard to diagnose what's too much mobility in a child. But because I was having these symptoms and my skin was really fragile, especially as a kid, it was like a really quick diagnostic odyssey, which is also super rare. Most of my friends with any type of EDS are about my age, like in their 20s, and a lot of them are just recently diagnosed. Yet it's generally present from birth. They just don't get a diagnosis for a long time. Because it was like the early 2000s, we still don't know a lot about EDS, but we knew like nothing then. I have like notes in my records that like of them saying PT wouldn't be helpful, even though it's like a very heavily orthopedic condition. They're just like, yeah, there's nothing you can do. Like, just live your life. We'll treat the dislocations and kind of like pick a sport that feels better for your body as opposed to what you want to do with your life, which I think is when my adaptive sports passion came up because I don't like when doctors just assume they know your interests. I think when I think back to like my pediatric options, I was young-ish. I didn't have a surgery till I was older because we kept postponing. But at that age, you don't fully have a say. Like you do, but like at the end of the day, it's not your call. And I did have quite a few surgeries recommended to me, but I'm not sure that they were communicated well enough to my parents. Because like I go back through my records and it's like all these like I recommend this, I recommend like that, but no other like, follow-up was pursued. And I get to me it really feels like no one fully was like this could help, or like we actually like I'm not sure it was made very clear. So I think part of that, like when you're a kid, it's like a lot of the parents understanding of what you're offering as a procedure. Um, and then there was one that I was older and my parents thought it was too aggressive of an option. Um, and I kind of agree, but we ended up finding like a second opinion and did a different surgery that was still fairly invasive. Because it was just the nature of like you still break a bone. Like it's not a small surgery. But we found a different one that was willing to do that instead of operating on like 4 places at once. And I was definitely more involved in that decision. And I remember like instigating that and being like, I want to go to college and have my knees more stable. Like I was terrified. It's still my biggest fear of like getting injured in public. So I was going away to college and I was like, I do not want to roll over in bed and have my college roommate like hear me cry. I was like, that's no, thank you. I would like to minimize that as much as possible. And I knew there was the really invasive surgery on the table that they thought could fix it. And then I was the one that was kind of like, okay, well, we need to either pick this one or like we need to go to the other one. And my parents at the time, I think, were concerned about me retaining athletic ability, and they just couldn't guarantee it with the more invasive one. They were like, we can introduce you to one family that has a kid that did it, and he's like kind of active. But it was like kind of like a vague offer. It wasn't super pursued. And I think as a young person, like your goals are different. And I think that's what you go into thinking like ideally, obviously I would want like less pain and more function, but my main goal at that point was like, can we physiologically like reduce the chance of my knees dislocating? Because my knees, while my ligaments were really loose, my kneecaps also sat like nowhere near the groove. So it could jump ship very easily. There was nothing holding it in really. So it made it easier. So I was like, well, if we can, I was like, I see the x-ray. I've studied science now. Like I am 18 years old. I think I turned 18 the day before my surgery. So like I was the one signing away those consent forms. Very quickly, I was like, oh, wasn't prepared for that. So that went into that one. And then my spine, well, I guess then my screws broke at my surgery, my second knee surgery. And I was in college at this point, so I was like 19 years old. And that one I kind of had to pursue completely alone, which is like brand new ball game. But my surgeon was like, that seems fine. Like, come back in a couple months. And to me, I was like, this bone is not attached. The screws are like floating. They are cut in half. I was like, I just think maybe waiting isn't the play. So I was the first one that had to finally go get a second opinion, and that was really emotional as a 19-year-old because I didn't know what I was doing. Luckily, I was a student athlete, so really I went to my athletic trainer and I was like, "Hi, my doctor said this. Like, what do you recommend?" And she got me in with a different surgeon, and that surgeon was like, "No, we need to fix it now." And I don't think the like immediate surgery type is as recognized as an emotional burden because they're kind of like, well, it's like, nope, like now. It's like we're fixing it. And it, just like it did my senior year of college, it like removes everything that you've known. So I think there's just like a little bit more of recognizing that saying those like simple words, even if it's just like a knee surgery, like in the grand scheme of surgery is not like the most invasive. It still alters everything that that person is going to go through for the next 6 months to a year.
This next rare disease highlight is also someone you may recognize from a prior episode of the podcast. This is Kait Williams, who has Ehlers-Danlos syndrome and miserable malalignment syndrome.
I had pain in my legs for as long as I could remember, but I thought it was normal. I definitely thought everybody had pain, and especially because I was, super athletic. I was a runner. I played tennis and soccer, tried all the sports. I thought that that was just a normal part of being active. And it wasn't until I was in college, actually in my occupational therapy class, one of my classmates asked me a question of if like what's the normal pain on the pain scale to have, and my answer was 5 or 6. And she looked at me and she was like, no, like you really shouldn't have pain. And then I definitely started noticing like I was running a lot at the time and training for half marathons, and like I would come home and my hips would hurt so bad, and I would even have my roommate help me kind of like pop my hips into place because like they felt like they weren't in the socket correctly. And yeah, and then after I graduated from college, the hip pain got really, really bad. So I decided to go to an orthopedic surgeon to see what was going on. And I got an MRI, and the MRI showed that I had the femoral acetabular impingement and a labral tear. And so that was when I had my first surgery, and that was the first of many. And that surgery itself was extremely difficult. I really struggled, with my communication, like with this surgeon in particular. And I didn't recover well from that surgery. And then I ended up having to have a revision surgery, like on that same hip, because it was worse than when I had gone in for surgery. And then I continued to have pain, and I found another surgeon who did the same thing on my left hip as well. And then I continued to have pain. So I had to really fight for answers because I knew that something, still wasn't right with my legs. And I definitely thought that, my legs looked different from everybody else. I could tell that my femurs pointed in and my tibias went out. And I think I kind of had mastered like, how to stand without making it noticeable, but like I knew something was wrong. So, I did my own research, and I even like turned to a Facebook group to see if anybody had any suggestions of like what I should do or where should I go to get help. And somebody actually commented on my post and mentioned miserable malalignment syndrome. And yeah, from there, I was able to find a surgeon who diagnosed me with the condition and was able to perform the surgeries. My first surgery was really difficult, with that surgeon, and we were not on the same page. And I guess I didn't really understand like what it really could be like until I found my current surgeon. And just how much he like takes the time to view me like as a whole person and not just an image. So like when it came to my diagnosis, doctors were only looking at my hip joint or my knee and not my leg as a whole. And that was a missing piece. Like I was having all of that pain, not necessarily because of things going on in the joint itself, but the entire structure of the leg. But I also think that my surgeon does a really good job of looking beyond the leg too. He looks again at my goals and how I'm feeling emotionally, which means the world to me. He takes the time, to actively listen to how I'm feeling, and he acknowledges all the emotions that come up with having multiple surgeries like this, encouraging open communication, sharing your story, your symptoms, and asking questions, as a patient is super important. And also for medical professionals as well, to encourage that kind of communication, and also, creating a safe space to be able to share these things, because, from a patient perspective, it can be really difficult to be vulnerable like that and to share, the things that you are struggling with in your day to day, or the pain that you're facing, or, the emotional aspects to it. Again, like collaborating on the goal setting, having like the patient's goals also be the medical professional goals, to the best of, your ability. There are realistic expectations. And I think also, from a medical professional standpoint, educating the patient about their condition, listening to the patient, respecting their autonomy is super important, but while also collaborating to find the best solutions, that balances the medical considerations with the patient preferences. Yeah, I definitely think in a nutshell, those are definitely things that I have learned, in my journey.
Welcome, Dan Shockley. Despite being asymptomatic and having no family history, Dan was diagnosed with attenuated familial adenomatous polyposis, or AFAP, at the age of 51. His diagnosis fueled his mission to educate medical students about hereditary cancer syndromes. Inspired by his collaboration with the late Dr. Henry T. Lynch, the founding father of hereditary cancer research, Dan continues to advocate for early detection and awareness.
I got diagnosed in 2012. I was 1 month from turning 51. I'd scheduled the colonoscopy. When I scheduled the colonoscopy, we noticed that there was a 14-pound unexpected weight loss. So my GI doctor said, well, I want to do an upper GI as well as a lower GI. I want to be able to rule out any underlying issues. And I said, let's do it. And, sedated. I woke up in the recovery room. My GI doctor standing next to my side, and he had photographs, which he shared with me. And I was a little bit groggy, just waking up from being sedated for an hour. He said, well, Daniel, I found 100 polyps embedded throughout your colon, rectum, and anus, and one of those polyps is causing an 80% blockage in your ascending colon. And I said, well, doc, how can this be? I'm asymptomatic. I don't know anything about what you're talking about. So you're going to have to, help me along the way here. And I have 2 jobs and I'm going about my life as if nothing happened. So, and he goes, well, this is the importance of getting a colonoscopy, because we can get in there and we can do biopsies and have a look-see and get the pathology reports, and then determine what the next course of action. And he says, well, right now you just woke up from your being sedated. So I want you to have a clear mind. I want you to come into my office. And this was Tuesday, May 8th of 2012. He says, I want you to come into my office on Friday. We're going to sit down. I'm going to talk to you about this, because I'm going to need you to go see a certified genetic counselor at Tripler Army Medical Center. I said, well, okay, what's going on? And he goes, well, I think you have a hereditary colon cancer syndrome. However, we won't know until we have DNA test results to confirm. our suspicion. The results came back. The gene mutation, it's in my 5th chromosome. The mutation itself is known as Adenomatous Polyposis coli, APC. Now, because I was 51, the window, if you're diagnosed with the APC mutation, the window for attenuated FAP is 50 to 55. I'm right there in that window. So now, little did I know, the AFAP, that mutation was, that diagnosis, that was discovered by the late Dr. Henry T. Lynch, the founding father of hereditary cancer research. He received a grant in 1984 from the American Cancer Society to, that 6 years later led to the discovery of AFAP being a subvariant of FAP. Now, the difference is FAP will impact those with the APC mutation from 50 years and younger. And the majority of the ones that I know that have FAP are symptomatic with family history. Now, I'm asymptomatic and no family history. So I had to wait. It took 6 weeks to get the results back. And I'm still reading. Till this day, I'm still reading about this because the mutation, Dr. Lynch, he estimates that less than 0.03% of the global population is diagnosed with it or have it. But we don't know. There's no statistics. A colorectal surgeon, a genetic counselor had me in the exam room and they said, Daniel, the results came back confirming you have the APC mutation, which means you have attenuated FAP. It's you don't have to have the surgery, but you need it. It's in the best practice of medicine to have the total proctocolectomy with a permanent ileostomy, because any of those 100 polyps left unattended have a 100% chance of developing into colon cancer. I go through routine endoscopic surveillance, and the mutation will and has impacted other organs. It's taken over my stomach. There's another part of the mutation that gets into your eyes, and that's known as CHRPE, C-H-R-P-E, and that's congenital hypertrophy retinal pigmentation of the epithelium. I have elliptical lesions in my eyes because of the mutation. There's nothing we can do about it. We just have to, no pun intended, we have to take it, we just have to keep an eye on it. I also have a second rare disease called Schwannomatosis in the 22nd chromosome. So APC is in the 5th chromosome. Schwannomatosis is LZTR1. That's in my 22nd chromosome. So I'm twice mutated. So, and Schwannomatosis is even more rare than AFAP. So as a result, I've been assigned to a neurologist or neurosurgeon at Stanford to go through some extensive testing. The first test I had was a MRI of my brain. The results came back unimpressive. So as I tell the medical community, there's nothing there. And it's not cancer related, but it would impact if you get schwannoma. You get these schwannomas, they're tumors, and they go around nerves. So it could be a neurological thing. But so far, there's no sign of any in my brain. But I have to go through 2 major testing down at Stanford, which will be in the next probably month or 2. And there's really no cure for what I have. So once we find out the mutation in the case of AFAP, we just have to hopefully prevent it from reaching further. So we averted the colon cancer by having the colon rectum and anus removed. The pancreaspirin, that was to remove 30 centimeters beyond where the 3-centimeter adenoma was, redo the bile ducts, and then remove my gallbladder so the mutation won't reach that. So, but yeah, rare disease. I mean, there's so many out there. There's, I really feel for the patients and their family members of those who are symptomatic, that are on medication, that have family history. I mean, I'm going in this I'm just trying to learn as much as I can. I'm trying to be like a sponge and absorb it, and then I share, but the rare disease, that's just it really just blows my mind. I mean, what are we up to 30 or 7,100? I think rare diseases, and wow, I mean that's globally. I mean, and that's what we know about. I mean, how many more are there that we don't know about? But this is the beauty also with the advancements in the DNA testing. So, we just hope that we continue with this with the message about Rare Disease Day. To help the families that have this diagnosis that they know about, and we also want to help. Want to destigmatize getting checkups. There's destigmatize getting a colonoscopy. Or what it's like to have a permanent ostomy. Um, I thought of years ago, well, a couple decades ago, I remember hearing that we have two choices in life: we can react or we can respond. And I thought of, well, I like to respond. I like to gather information so I can make a logical decision. Yeah, I react a lot too, but when it comes to medical, decisions, I gather the information so I can try to process it. And I've been fortunate, so far. So, and that's been a good, I learned that from the military. Is once again another thing I've learned from the military. But share my journey, you know, it's going to help the rare disease community as well.
Thank you for listening to this special edition episode of the Patient Perspectives podcast. And thank you to the guests who contributed their rare disease stories, because everyone can learn from these experiences, and we need to amplify the voices of those affected by rare disease. So I am grateful to each and every one of the guests who shared their story, not only on these segments of today's episode, but also sharing their larger story on a full episode that you can find either on Spotify now or in the next few weeks. Some of those guests have their full episodes coming out, so I hope you will take a listen to those. And again, happy Rare Disease Day. I will say, advocating bringing awareness to rare diseases doesn't have to happen only on Rare Disease Day. The fight never stops. More education, awareness, advocacy will be happening throughout the year, every year. So thank you to those who continue to advocate on behalf of the rare disease community. If you liked this episode, I would love it if you would leave a comment, rate, subscribe on YouTube, Spotify. Regular episodes release every Sunday at 8 a.m. Eastern Standard Time. This coming Sunday, I cannot wait for you to hear more about Camryn Berry's story. So until Sunday, just a couple days away, look forward to that. And thank you again for listening. This episode means a lot to me, and I hope it can highlight the important stories of the rare disease community.